Good afternoon, everyone. My name is Rizka from Leicester, just like you, part of Leicester Center for Phage Research. So this work that I'll present today is part of my PhD, which with the title In Vivo Efficacy of a Phage Therapy Cocktail that Targets ESBL-producing Klebsiella Urinary Tract Infections Clinical Isolates. So we've been talking about this many times today, but urinary tract infections is just infections in any of tissues of the urinary tract, and then it affects all ages, but the prevalence is higher in women. And then we've known this from the previous presentations as well. There are some pathogens that causing UTI, but the most prevalent is Phage, E. coli, and one of them also Klebsiella. And both strains encode extended spectrum beta-lactamases, or ESBLs, which express resistance to antibiotics. And also it is included in the list of antibiotic resistant priority by WHO. So basically, the work that I've been doing is continuation from work from Dr. Melissa Haynes. So we have also collections of phages in our lab and also from collaborators. And then we have information about the host range of the phages as well. And then we try to make some cocktails or two combinations of phages. You can see there's, I just named it cocktail 1, which consists of phage 311F and 05F, and cocktail 2, the same phages, 311F and 05F, plus 4 other phages. And then we then try to test or to compare their killing effectivity by using phage killing assay and virulence index. Then after we decided which cocktails is better, then we run them, we purify them through EndoTrap HD to reduce the endotoxin level in the cocktail. Then after that, run them through the UTI in vivo models to assess the efficacy. And then after that, obviously assessing the bacterial burden in bladder, kidney, spleen, and blood. And then we also take some samples for histopathology analysis. So for the first part is the cocktail optimizations. As you can see there, cocktail 2 with more phages in it has broader killing effectivity. So it's around 77%. So, and then can I go into detail about what each phages do, but then obviously adding more phages in the base cocktail like 311F and 05F broaden the killing effectivity of the cocktails. Then after we purify the cocktail 2, we run them through our in vivo model. So for our in vivo model, we put on day 0, so it's an acute infection model, so running for 7 days. So on day 0, we put in Klebsiella pneumonia top 52, so known UTI strains for with the titer 10 to 7. And then we let the infection establish until day 2. And then on day 2, we put in the phages transurethraly as well with the titer 10 to 6. So the MOI is around 0.1. And then we observe the mice until day 7, and we tried to take the urine samples taken every day to monitor the infections. So this is the bacterial burden from urine, bladder, and kidney. As you can see, they have the same trends. So in the urine, say for example, on day 2, after 4 hours, we inject the phage. You can already see that decrease in the bacterial load. The same in the bladder. On day 2, after 4 hours of infections, you can already see the decrease of the bacterial burden in the bladder organs, as the same in the kidney. And then we see consistent infections in the control until day 7, and then we see consistent reductions in the phage-treated group until day 7. We also try to recover the phage from the mice Obviously, the phage treated group has higher phage because phage can replicate there inside compared to the phage control group. So as I mentioned before, we also do histopathology to assess the inflammations reactions during the phage therapy and during the UTI infections, as you can see in the graph on the right, that the orange one is the control, the blue ones is phage treated, and as you can see on day 7, the phage treated group has a lower inflammation score. So inflammation score that we use is range from 0 to 5. The higher the number is, the more inflammations happening in the tissue. And then basically what we see is like the changes in epithelial cells and then extending into the smooth muscle and then connective tissue as well. So this is just the example on how the, the, the tissue looks like. This one is like normal ones, and then this one is grade 4, so it's like quite severe. And this one is post 2 days infections without treatment. It's it has a most severe inflammation score. This is 4 hour post phage. It has lower, so degree 3, and then so on. So we also do some other work as well, such as current work that I did is like combining cocktail for ESBL, producing E. coli and Klebsiella for in vivo evaluations, and then we do try to combine them with antibiotic as well, and then we try to test our phage cocktails in 3D urothelial human cells models, so it's like organoid models. We do collaborations with Professor Jennifer Wan from University College London, and then we're also trying to assess the cytokine profile to know the inflammation reactions from our in vivo and in vitro model. So thank you for listening. Thank you for my supervisors and all people in the lab. Thank you so much.